Hi everyone and welcome to this video. My name is Jess and today I'm going to film my 4-week pregnancy update. So to get started, if you see me looking down, I have got my book of notes here as I've got lots to update on this time. So don't mind that if you just see me looking down. I am 29 years old and I'm from the south of England. This is my second pregnancy. I already have a 9-year-old daughter from a previous relationship. Currently I am engaged and this is mine and my fiance's first baby together. So the first thing I'd like to note is these updates from week 4 to 12 are going to be pre-filmed. I will not be posting them in real time. Once I am 12 weeks, these will have been posted maybe like a day or so apart. I'm not sure how I'm going to quite work it yet. But then once I hit 12 weeks on, any 12-week plus updates will be posted kind of real-time-ish, maybe like a week delay-ish. We'll just see how I get on with the editing side of things there. So my hopes for doing these updates is it will be really nice to be able to look back on these things. I wish I'd done something like this when I had my first daughter, and yeah, I hope to take you along through every week in my pregnancy for hospital bag videos, weekly updates and much more as we go on through this pregnancy as well. So first I thought I should start with how I found out. So sometimes regularly I will take the odd pregnancy test just to rule out pregnancy and stuff. Sometimes I'm not too sure. Sometimes what feels like period symptoms could also be pregnancy symptoms. And yeah, it was just one of those times. So I found out when I was just 3 weeks and 5 days pregnant. That is according to going off my last period and how it's worked out my due date from that. So I just had really cheap tests at home and it instantly came up. After that I went straight out and got a clear blue test, and on that test it told me that I was 1 to 2 weeks pregnant. So now I'm going to go into week 4 of my pregnancy and all the symptoms that I have been experiencing so far and things that led me to believe that I was pregnant, which I now know was the case. So the first thing is I began to get nauseous around meals. Now I'm normally someone who can eat lots and always be hungry, but feeling nauseous around food times isn't normally like me. I've also noticed a decrease in my appetite, which for me is quite a big thing. As I said, I've normally got a really big appetite, so that was like one big sign to start with. Another one of the early symptoms that I noticed was the fatigue. I was getting very sleepy in the afternoon around times that I wouldn't normally. So say we had been out in the daytime, I was falling asleep and having naps in the car on the way home. Now, if I'd had a really long day out, I'd probably do that, but the days that we were going on wasn't too exhausting for me to be doing that. That is also one of the main first symptoms I had with my daughter. I was very, very exhausted. When I had her, I used to come home from work and take a nap, which was a big telling sign at the time. So yeah, I've definitely been experiencing that this time as well. A few other period-like symptoms that I had been getting was sore boobs. I normally get that before my period anyway. I usually get that maybe like 1 to 2 weeks before. So that's definitely something I've been experiencing. It felt exactly like that, so it would be hard to differentiate between the two. But that's definitely something I've experienced this time. Another thing I have been getting is a few spots around my chin. Now, I'd been on medication a little while ago to clear up my skin, and this had worked. So then to start getting the odd spot now was different because that had fully cleared up for me for a long period of time now. So to start getting that again, yeah, was different to what I would normally experience, definitely. And then another feeling that I would sometimes get is I was getting like slight cramping pains kind of quite low down around like where I imagine the ovaries are. Now I often get this when I'm ovulating, so I thought it was a similar kind of pain to that, but what I thought was probably that or period pains at the time I now believe to be implantation cramping is probably what that was for me. Another thing I had noticed was that I've been getting quite a dry taste in my throat, just like a dry mouth, dry throat. And yeah, I tend to get that similar kind of feeling when I'm not feeling very well. So yeah, it was hard to tell if I was getting unwell or not, but looking back on that now, no, that must have been like a pregnancy symptom for me, was to like start getting a dry mouth. I've also been feeling quite hot, especially in the mornings. I've kind of been like having a hot flush, and I'm usually someone who is always freezing cold. So yeah, that's definitely something else that I've been experiencing as well. Very shortly after I found out, I did actually inform my work. So I currently work full-time, and it is a very physically demanding job that I work in. I'm required to lift very heavy things all day. So for me, a low is something that not many people would do, and work is the first place that I have told and will be telling for a long time. It was really important for me to be able to protect myself in that way, and they have been able to accommodate, so I am not overstretching myself and lifting things that are way too heavy, because sometimes they do pull my back and things at work. I try using all the proper techniques, but these things happen. So yeah, that was definitely something I did to help protect myself going forwards with work. My next step this week was contacting my doctors, as I'm currently on medication. I have a few little issues with my heart, so I'm on beta blockers for that. I don't tend to get any symptomatic problems with that, but this seems to help with my problem. So I spoke to them about that, and they gave me lots of information to do with taking that medication in pregnancy, as it does say to consult your doctor. And they kind of came to a conclusion that I personally would be best to stay on the medication, as I'm more likely to get more problems coming off it than to staying on it. They did talk through a few of the risks that come with taking the medication. So by carrying on taking the medication, I am at risk of having a smaller baby. It will mean that I'll need to have an extra scan for growth further on. It also means that following the birth that I might need the baby to be monitored at special care for a little while after. That is just to monitor the sugar levels and just to check that everything is okay following that. They did tell me that as soon as I get a midwife appointment, to just make it clear to them that I'm on that medication, so they know that I need care for that and the things like extra appointments and things that I might need going forwards as well. The next thing that I personally started doing was taking folic acid. So yeah, I just picked that up from the shop and began taking that. It's recommended that you take that up to 12 weeks or beyond, I imagine, as well. So I'll be taking it up to at least 12 weeks. I then also self-referred myself to the maternity services. So if you don't know, you don't directly go through your doctors. That's something I learned the first time round. But on the NHS website, you can use a self-referral form. You just fill in out your details, and then that gives the maternity services a line to get in contact with you. So around a day or so after I sent in my maternity service referral form, I had a phone call back from them. This phone call lasted around 10 minutes, and they were basically asking a lot of questions. So I'll just run through what kind of things they were speaking to me about and what they were asking me. So the first thing they began to talk about was I aware of what I should and should not be eating? Asking if I was taking folic acid, was I taking this before I conceived as well? They also recommended that I started to take a vitamin D supplement as well. They then went on to ask about relationship status, living status, where you live. They asked about the baby's parents' addresses, so where me and my partner were living. They also ask questions about the partner, such as do they drink, do they smoke, do they have any mental health issues, was this ongoing before becoming pregnant. They ask your partner's age as well, as yours is already filled out on your referral form. They then asked if I drank any caffeine and to explain to limit that. However, for me, I am not a caffeine drinker. I don't drink coffee or tea or anything like that, so that was not an issue for me. They also then gave you the information for the midwife app that they use in my area. So basically all the appointments are booked on this system. So they gave you the login details for that, and that is where you'll view your appointments. She explains to me that I will have a phone call midwife appointment at around 8 weeks. Now on my midwife app, I haven't been given an exact time slot. It is just like the time frame of the day, so I'll have to wait around for the phone call. She said that phone call should last around 40 minutes and she'll be going into lots of medical history details and things like that. So yeah, I'll have to write down a few things if I want to ask them, or things that I'll need to remember for that, as that will be a long phone call. But yeah, that was it for that phone call really. And yeah, I'll just have to wait till the 8-week appointment now to find out any more information that I need. Finally, following on towards the end of week 4 after that phone call appointment, I started taking my vitamin D supplement. I had a little bit of lower back pain, but again, this could have been from work and just like bending and twisting the wrong way, as this seemed to disappear off by the end of the week. I did start to get a bit of brain fog as well. I became a little bit forgetful with things that I wouldn't normally forget, or even just like my speech just then, just forgetting what I'm going to say halfway through. And I have also experienced a bit of gagging as well, just at random points as well. So that's another fun symptom that I've had. So just to start finishing off, as I previously said at the start of the video, these videos are not posted real time until I hit 12 weeks. So once I'm at 12 weeks, those videos will be in real time. But yeah, I thought now I'll just show you a clip of my belly. I'm gonna do this probably at the end of every week, just to show the progress as we go on. Obviously these first few weeks you can't see anything, it is just bloating and haven't got the flattest stomach anyway. But yeah, it'll be nice to look back on at the progression further along, so I thought I'd start that in the videos now.
So this is me at 4 weeks and 6 days. As you can see, nothing there. I am just bloated at the minute. It is the end of the day and I've just had dinner, so probably not the best time to show you, but I'll start to get a bit better at that. But yeah, that's where we're at so far.
But yeah, that's it for this week's video. Thank you so much for watching, and I'll see you again next week. Goodbye.